I'm Dr. Kavita Chintala, Clinical Director and Senior Pediatric Interventional Cardiologist at CARE Hospitals, Hyderabad. Won't it be nice to know if your baby has or does not have a heart defect before he or she is born? Well, this is possible in this day and age by a test called fetal echocardiography. Fetal echocardiography is an ultrasound imaging of the heart of your baby while the baby is inside your womb. Why is this test so important? It is important because congenital heart defect is the number one birth defect. It is also the number one birth defect that causes the infants to die. Hence, it is very important to diagnose these defects as early as possible so that we can provide appropriate and timely treatment for your baby. So, what is fetal echocardiography? As I mentioned, it is just like any ultrasound that is done on you while you're pregnant. So, it looks at the heart, the structure of the heart, the rhythm of the heart, and the function of the heart in great detail. This is typically done between 17 to 20 weeks of pregnancy. It can be done earlier when the images are allowing for good penetration of the ultrasound waves, and it can be done at any time later also whenever the need arises for a fetal echocardiography. Now, what is the advantage of doing this fetal echocardiography? As I mentioned, it is very important that we know whether the baby growing inside the womb has a heart defect or not. This allows a few things to be done. It allows for the parents to be emotionally and financially ready to receive a baby with heart defect because it has huge implications to know that there is a defect in the baby. Of course, it is reassuring that there is treatment in most of the cases. Treatment is available for the heart defect, but it is always good for the family to be prepared to receive, give birth and nurture a baby with heart defect. Now, for the healthcare team, it is also very vital that we know that the baby has heart defect because it allows us to prepare to receive such a baby. Now, 1 out of 4 infants with heart defects have a critical heart defect. Now, a critical heart defect is something that will require treatment early, either soon after birth or within the first month. These infants need either an intervention or a surgical procedure in order to enable them to live their life successfully. So these are critical heart defects, and the focus of fetal echocardiography is to pick up these heart defects because if they are missed before birth and if they are missed in the nursery and the babies are sent home without detecting these defects, then they can be lethal or the outcomes can be very bad when they are diagnosed lately. So that is the advantage of doing a fetal echocardiography. Now, who needs a fetal echocardiography? Ideally, every pregnant woman should undergo a fetal echocardiography because the heart defects are the number one type of birth defect. So, because it is the commonest kind of birth defect, we need to make sure that every baby is free from heart defect or at least know that there is a heart defect. So ideally everyone should get a fetal echocardiography, but in case there is shortage of resources in a country like ours, everyone may not get an advanced fetal echocardiography by a pediatric cardiologist. So there are certain indications or certain conditions where the heart defect is common and we target these women at least to perform a fetal echocardiography. Now these are babies with a family history. So if a sibling or a parent has had heart disease or a first degree relative has heart disease, these babies need to be screened with a fetal echocardiography. And then when there is an abnormality that is suspected on a basic targeted imaging for fetal anomalies that is done on all pregnant women by the obstetricians, whenever the heart does not look right, then they are sent for an advanced fetal echocardiogram. In addition, the other indications are when the fetus has a extra cardiac anomaly, meaning there are some other abnormalities in the baby, then the risk for heart disease is there, so they get sent. Then apart from the fetal cause, and again among the fetal causes, the twins need a fetal echocardiogram, and whenever there is fluid in the body, what we call hydrops, then the fetal echo is required, and whenever the rhythm of the heart is not normal, either the rate is high, the rate is low, or there is an abnormal rhythm, those babies also require a detailed fetal echocardiogram. Now apart from these, some mothers that are at risk require a fetal echo, which are maternal diseases like diabetes, phenylketonuria, connective tissue disorders, seizure disorder, a mother taking some drugs, a mother who has been smoking or is an alcohol are at increased risk, a mother with a rubella infection, a mother that is obese, or an artificial reproductive technology has been used for pregnancy, all these will require fetal echo. Having said all this, however, the heart defects can happen in a low risk mother. A mother that has no risk factors can also have a baby with heart defect. Hence, looking at all the pregnant women is essential in today's age. Now, what happens after we detect a heart disease? Now, it is once we do a fetal echocardiogram, it is a great news to be able to tell the parents that the heart is absolutely fine. So it gives a lot of relief for those families that are suspecting any underlying heart defect. So apart from this, when we find a heart defect, the minor ones, there are minor ones and there are major ones. There are very few what we call single ventricle anomalies where one chamber, one main pumping chamber of the body is missing. Such ones may be sometimes lethal, or I wouldn't say lethal, but the quality of life after offering surgery may not be very good. So the option of not continuing such a pregnancy may be provided to such families, but majority of the heart defects are nowadays amenable to treatment. So we decide what is the kind of heart defect and what is the therapy that is required, and the healthcare team plans out a safe delivery plan. So the delivery plan is usually made by a multidisciplinary team. So the pediatric cardiologist, the pediatrician, the obstetric team, the fetal medicine people. So everybody sits together and discusses what an ideal delivery plan is. Now the delivery plan may vary depending on the type of heart defect. For critical heart defects, we would like to deliver them in a place that has pediatric cardiology support. Usually the duration of pregnancy would remain the same, meaning early delivery is usually not indicated unless the fetus is in severe heart failure. Now the mode of delivery also, typically we allow vaginal delivery except again there is heart failure and a need for assisted delivery. Sometimes that may be the case. But so it allows the team to be ready for all these planning is made. Now once the baby is delivered, for critical heart diseases, one more advantage of fetal echo, particularly in India, is that if we don't detect the heart disease and the baby is delivered in a periphery, either the baby is undiagnosed, or when the baby is transferred to a tertiary care center, it may be too unstable or critically ill for such transfer. So fetal echocardiography allows the transfer of the baby in the womb. So such mothers, we get them to the tertiary center for delivery rather than allowing them to deliver in the periphery. So it is what we call transport in the womb. So that is also possible by fetal echocardiography. Now once the baby is born, then we would have already identified the plan of care. So whether this baby needs an intervention, how soon is the intervention, or if the baby needs surgery, what time the surgery should be done. So all these details are chalked out prior to the baby being born, and hence we are able to provide proper timely care, and this will decrease the infant mortality and morbidity and will help the families a great deal. Thank you very much.